So we are going to talk about psychotherapy with children, youth, and families. Kinark Child and Family Services, we're an extremely large children's mental health organization. We have both the honor and the burden of having one of the largest wait lists in the province. It's an honor because people like you trust us to provide service to your children and families. And it's a burden because, we have only so many resources in order to do that really important job. And we really feel that and want to see as many clients as possible. One of the questions we get all the time from our families who are waiting for service is, what are they waiting for? So it's not just how long they're going to be waiting for service, but what are they waiting for exactly to ensure that, we're an organization that is really going to be able to meet their needs. So this is kind of why this presentation, we thought was really important for this family education series. So thanks for joining. All right. Okay, so today we're going to talk about, as the title suggests, what is psychotherapy? I'm going to talk a little bit about how it differs from counseling, because you've heard those terms before, likely. We're going to be specific about what psychotherapy is with children and adolescents, because that is the group that we serve. And we're going to talk about what typical treatment goals are for children and adolescents. We're going to talk a little bit about our autism services as well, because that's separate from our child youth mental health programs. We're going to talk about possible interventions with children and adolescents. And then we're going to go through our kind of 4 main service offerings here at Kinark, which are CBT, cognitive behavioral therapy, DBT, dialectical behavior therapy. We have some group therapies that we're going to discuss. And then we have something called SNAP, which is Stop Now and Plan. So we're going to give you the information in terms of what are each of these, who's it for, and what to expect when you enter into that service. And then finally, we're going to talk a little bit about what's really important across all of these different services is showing up and doing some work. All right, so let's go ahead and do that. Okay, so what is psychotherapy? So psychotherapy is a therapeutic approach. I don't know why it's doing that, but I will keep an eye on that. It's a psychotherapy approach where trained mental health professionals help individuals understand and manage their mental health issues through various techniques and strategies. Now, mental health issues could be things like anxiety, avoidance, including school refusal, depressive symptoms, behavior problems, anger management. There could be social skill deficits or even risk and delinquent behaviors. So those could be kind of some of the mental health issues that are bringing families to us here at Kinark. They could be receiving service for psychotherapy. You can get it in an individual therapy format. You can get it in group therapy, family therapy, or even couples therapy. I'm also going to talk about this term called evidence-based practice. So evidence-based practice, it's, it is researched. It is, so that's what it says, has evidence. It involves using this high quality research findings to inform your treatment. It's standardized because when they're researching the practice, they are ensuring that everyone is doing it a certain way, and then they're measuring the outcomes of that practice. And then when it's evidence-based, it is proven to have positive outcomes if the clinician performs the practice as described or prescribed. So if you're doing evidence-based practice, the advantage of doing that is that it reduces variability in treatment quality because it's a standardized treatment and you have to hit all the points in terms of providing that treatment. And therefore, then it increases the likelihood of positive outcomes because the evidence suggests that you will get positive outcomes if you do the therapy in the prescribed way. So that's what evidence-based practice means. All right, next. Let's make sure it doesn't. Okay, so let me talk a little bit about psychotherapy versus counseling, because you've heard those two terms likely. And at Kinark, we provide psychotherapy. We actually don't provide counseling at Kinark. So psychotherapy is more comprehensive treatment. It is a series of usually weekly sessions. It actually could be bi-weekly. It could be twice a week. It depends on what the nature of the service that you're receiving. But it's usually a series of sessions, and it's performing these evidence-based practices. So there are these theoretical approaches that are prescribed and they are standardized. And it's, for CBT, for example, it connects how thoughts, feelings, and behaviors are all interconnected. There's home practice strategies. You're tracking progress towards specific goals, and you're really looking to see significant changes in behaviors, emotions, overall mental health, but it's really about improved functioning. Whereas counseling is more specific to some life challenges. It's usually just a few single sessions. It's really intended to be solution focused. It gives lots of practical advice. There's problem solving strategies, coping strategies. And it's really about helping clients resolve really specific problems, and it's supportive in nature. And I don't want anyone to get the idea that one is better than the other. It's just different. And it really depends on the needs of the individual with respect to which one would fit for that client. Okay, Megan.
All right. So we've heard a little bit kind of broadly about what psychotherapy is. And I think most of our understanding of psychotherapy comes from the media, from the way it's depicted in movies or television shows, or from our own personal experience. But what's important to highlight is that psychotherapy for children and adolescents tends to just look a little different. So the goals, everything that Laurel just talked about, are the same, but the way that we do it, the way that it looks and feels to kids and teens is different because their development is different, of course. So when we're developing treatment for young people, we're considering their development, we're considering their thinking and reasoning skills, we're considering their language, their understanding and experience of emotions, as well as how much time they can actually spend paying attention to something or engaged in the process. We have to think about that when we're developing a treatment for them. We also consider the environment and the materials that we use to engage them. So as you can imagine, the treatment environment at Kinark is colorful, it's child-friendly, it's fun. And we use materials like fun seating arrangements and fidget toys and games to create a space that's welcoming and engaging for kids. That's a little bit different than you'd see in a mental health setting focused specifically for adults. The other important thing that's kind of unique about supporting kids and adolescents is the way in which we build a relationship, which is foundational for any treatment, looks a little more fun and engaging. So if you were to walk by a therapy room with a child or an adolescent present, you'd likely see people up and moving, writing on the board, playing games, like really doing a lot more than just sitting and talking. And of course, this kind of changes as kids get older and their capacity to think and reason changes, and they have more language. But we really try to tailor the approach to the child in front of us and engage them in a way that's going to feel supportive and fun, but also be really effective in making change. The last point I want to highlight, and I'm going to talk a little bit more about this later, is parent involvement. As you can probably imagine, when kids are younger and they come in for psychotherapy, we focus a lot of time on them with their caregiver, involved in the treatment together. And that might change as they get a little older, but parent involvement is always important, or caregiver involvement is always important when we're talking about young people, children or adolescents. So, Laurel kind of already outlined some of the reasons why people come to see us. But when we get you started in the process of psychotherapy, we sit down and we collaboratively develop with you goals for treatment. So again, psychotherapy is goal oriented. We want to make change with your child, with your family, that's going to improve your functioning and improve your quality of life. And so often we're looking at treatment targets that involve things like emotion regulation, which means understanding emotions, how they're experienced in your body, and learning ways to manage emotions and any discomfort that might come along with that. Similarly, we learn or we often target in treatment behavior regulation. So in response to emotions, we often do things. We avoid, we withdraw, we act out, and in order to gain better control over the behavior in response to emotions, that's often a main target for our treatment. Of course, we often consider social skills and developmental support as part of the treatment, although Laurel's going to talk next about other services that sometimes more specifically target these two areas. And then we support parents in the psychotherapy that's offered to their youth. So we teach parents skills for responding to their youth. Which we always say to parents, we sort of teach them to be super parents. The things that don't come in the baby book are the things that we teach in psychotherapy for families. And we also target the parent-child relationship in treatment. That's often a goal. I want to feel more connected to my child. I want to enjoy time with my child more when maybe I've noticed that my family started to focus more on my child's anxiety or my child's low mood. And I want to feel like I enjoy being within my family again. So that's often a primary target within our treatment.
Yeah, and as Megan said, Kinark also has a separate service stream. We have autism services. So Megan and myself, we work in our child and youth mental health service stream where we do actually treat autistic youth who have mental health challenges. However, if you are looking for interventions to target some of the behaviors associated specifically with autism spectrum disorder, then our autism services would likely be a good fit for your child. So there are some, free services that autism provides. And there are also a range of individualized services that are available for purchase. It is a fee for service. So since the Ontario Autism Program has shifted to provide families with autistic children the funds, and then they get the opportunity to choose how they want to use those resources. So that has shifted within the province. So hence now all autism, ABA service providers now are operating on a fee for service basis. So you can get free consultations with our autism services to help you make decisions about what would make sense for your youth if this is an area that would fit better. So I left the number there to call. And then just the other thing around that is, sorry, oops, I moved this. Hold on. This is when you have more than one screen. All right, so then these are the range of programs and services that our autism services provides. Foundational family services, they will do psychological and behavioral assessments. There's center-based applied behavioral analysis services and other services. So what I recommend, again, that if you're looking for something more in that line, then please go to our autism service stream. They are more than happy to help you out. As I said, in our child youth mental health program stream, we do service youth who have autism, but it's really about targeting their mental health challenges. And we do that by adapting the interventions that we're going to talk about to target the mental health challenges, but adapt them based on the individual needs of the youth. So we may do things like make sure we apply a lot of routine and consistency. We use a lot of visual aids with these sorts of clients. concrete examples are really important. We ensure that our environment is very sensory friendly. We allow more sensory breaks, for example, and we definitely adjust our pacing of the material and ensure we do a lot of repetition and reinforcement. So those are the changes in the adaptations that our mental health professionals will provide to children and youth who have autism within their clinical profile.
And can I just add, Laurel, sorry, just
Yeah.
we also integrate the impacts of autism on a youth's functioning in our understanding of their mental health. So we are thinking about how things like sensory sensitivity increase their vulnerability to emotion dysregulation, for example. So we do really try to integrate our understanding of both to serve the child that's in front of us in a neuroaffirming way, like Laurel just highlighted.
Yeah, thanks, Megan. So I'm just going to give you an overview of many different interventions that could possibly be offered to you if you were to enter the child and youth mental health sector. Not specifically Kinark, but you could be going to another organization within your area. And there are lots of different interventions that are evidence-based that will serve the needs of children, youth, and families. There's behavioral therapy, CBT, DBT, parent-child interaction therapy, art and music therapy, play therapy, solution-focused brief therapy. There are attachment-based therapies, mindfulness-based therapies, interpersonal therapy. I mean, there are a myriad of different types of interventions that could be offered to a child, youth, and family. And this variety of interventions is really dependent on the unique needs of the child, youth, or family, and it would match what the needs are, but it's also very dependent on the training and experience of the clinician, and also their values and interests and orientation will dictate what kind of psychotherapy that is going to be provided. So.
And regardless of the type of intervention provided, I'll just highlight again that anytime we're looking at a psychotherapeutic intervention for a child or an adolescent, we're focused on the family and we're involving the caregiver. And we really highlight that because understandably, there's often a misunderstanding that when you come to child therapy or adolescent therapy, the focus will just be exclusively on the child or adolescent, which would make sense because that's what it looks like when it's an adult that goes to therapy. But of course, a youth functions in the context of a family and has a lot of interaction with their caregiver. And so we're in this unique position where we can actually affect a lot of change and we can support treatment when we treat both the child or the adolescent along with their system, along with their caregiver. And what's highlighted here is, you may come to us for an hour a week, but there are a lot more hours in the week. And a really knowledgeable, skillful caregiver who's learned a lot of what we're doing in the therapy has this unique opportunity to support their child or their adolescent's use of skills in the real world. So that's one of the primary reasons why we want to support caregivers to be involved in the intervention, no matter what option becomes available to your family, because they have the ability to spread the treatment potential into like the real world. What we also know is that youth learn a lot through observation, through watching. And so while we might practice with them different skills, they learn a lot when they see their caregiver model the skills that they're learning in the treatment. So when caregivers start to kind of like live the skills that we're teaching the youth, they're also supporting the youth's learning in actually seeing it into practice. And finally, what we know about behavior is that it responds to the environment. So anybody who responds to your child's behavior has the ability to either increase the likelihood of it happening again or decrease the likelihood of it happening again. And so a caregiver who receives kind of specialized service, you have the ability to actually impact your child's emotion regulation, to impact their behavior in how you respond to it. So we really try to skill caregivers up to be like these super parents who understand why the behavior happens in their child, and then to help them change the environment in a way so that it actually supports the change, which is really cool and just important to know as you're coming into service, because sometimes a little bit different than what you'd expect. So, as Laurel highlighted already, we sort of have these four main types of intervention that we offer at Kinark. So you saw there's all kinds of interventions available, but we offer four different types. We offer cognitive behavior therapy in an individual way, dialectical behavior therapy, which has a lot of different components. We offer group-based treatment, and we offer SNAP. And we're going to talk about each of these in a little bit of detail so that you sort of know what you'd expect if that were the treatment you were to be offered.
Let me talk about, helping parents understand what the journey through Kinark looks like is often helpful. And the infographic on the right hand of your screen is very, very busy and wordy. Actually, that's the infographic that our clinicians use as their guide through treatment. So these are all the things that our clinicians do at each stage of treatment to make sure they're on point and that they're providing and doing everything that is adherent to the model and of high quality. So that's kind of, that's an infographic for our clinicians. I mean, you're welcome obviously to see, because this is happening to you as you are a receiver of our service. But we do have our first kind of intake stage where you call our central intake line, and that's when service is requested. And intake will do an initial kind of screening assessment, because what they're really trying to understand is what's the nature of your issues? What are the things, is it a good fit? Do we have what you're looking for or what you might be requiring? And we're trying to get as much information as possible so we know then how to then direct your referral through our system. Now, as I said, we have a long wait list. So there is a wait period. We do triage our clients who are of our highest needs. And when I say highest needs, we define that as those clients who have the most risk behaviors. So whether or not they are at risk to themselves, at risk to others, or they're doing a lot of risk to property damage, those are kind of the indicators that we look at to prioritize those types of clients into service. Once they are admitted into service, they then get an updated kind of mini screening interview to ensure that, okay, how are things, have things changed, so that we again can assign to the most appropriate service within our system. Our assessment phase is getting that detailed information about your child's needs. It is about collecting any collateral information, what information or assessments or services have been provided in the past. How can we learn from what you have already accessed and all those other professionals that have done work with your family? How can we learn from that and build upon that? So we get all of that information. We integrate all of it into a case formulation, and then we present a treatment plan. So the treatment plan will be presented to the client to get agreement. Yes, this makes sense for me. That's exactly what we're here for. We want to work on that. So, yep, buying in, let's go forward. And then you go into the intervention phase, where the intervention is then applied and we're working together to meet the goals of the child, youth, and family. We track progress on these goals. How are we doing together on reaching our goals? Is it that things are going well? If they're going well, great. If they're not going well, what's the reason they're not going well? Do we have to make some shifts? Do you have to make some shifts? Like, we're really attuned to all of that so that we're not wasting time and we're making sure that you're getting what you need before we then move to discharge. So I'm going to talk specifically now about each of our interventions, and then you'll see kind of how that's applied as as we apply those through the journey through Kinark. Now, this is the intervention phase. Now, here, I'm going to talk about cognitive behavioral therapy. So this is, obviously it's evidence-based. It is a therapy that helps us understand how our thoughts, feelings, and behaviors are all connected. And so when we understand that, then we can look at how we can do things differently at any point of that, what we call the cognitive triad: thoughts, feelings, behavior. Are we going to do interventions with our thoughts? Because often in CBT, we really analyze some of those thoughts that are problematic, that, I'm stupid, I'm worthless, nobody likes me, I'm a bad kid, how those types of thoughts might be impacting how the youth feels and then what they're doing based on their behaviors and their thoughts. So there's lots of different strategies that we apply once we have that understanding of how thoughts, feelings, and behaviors are interconnected. All of our treatment plans are individualized to the unique needs of the client. Everyone is different. So we are really focusing on how we can make sure we understand the unique needs of each client so we can apply the appropriate strategies and techniques to each client. Our service is very family focused. As Megan already described, children are not operating in a vacuum at all. They have a support system around them, and everyone has a part to play to support the needs of that individual child. So doing this type of work, it does require commitment. It requires, a buy-in to the work that we're going to be doing together. And it requires practice. So we'll be providing to the child, youth, and family, we'll be providing strategies, we'll be providing home practice, because as you saw before, 167 hours of the week, you're not with us. You're out there on your own, but we want to make sure you have tools to take with you so that you're not out there, not, just struggling and floundering. So we do that. It is time limited. You're not going to be here forever. So like physiotherapy, there are goals, there are things we're going to be working on together. You have to do your homework or your exercises in between your appointments. And then, we'll be measuring your progress so that then we can demonstrate to you that, this is great work. You're not going to be, we're not going to keep you in our service for extended periods of time, because we now know that you have the tools that you can use on your own, right? So that's really important. So this again is like similar to kind of the journey through service, but it's a little bit more specific with respect to our timelines. Because as I said, we have a long wait list. We have a goal to help as many families as possible. So we need to be effective, and we need to kind of move families along their way when they're ready to do that. And we have such a belief in the high quality of our services and the fact that we have data to track positive outcomes and progress, that we know that you're going to be good after you receive our service. So this is really about the timing of when you enter our CBT service. We are going to do an assessment. It'll take 1 to 2 weeks. At week 3, for example, we'll talk about, here's the treatment plan. Are you in agreement? Does this resonate with you? Is this like going to be meeting your needs? And then at, week 4 treatment is beginning. Like the CBT is now it's operating, it's going, it's driving along. It will continue. We have a goal here at Kinark to provide our CBT services within a maximum of 20 weeks. And that is well within what research evidence suggests is necessary for majority of mental health presentations. Now, that's not to say we're not flexible and we're not meeting the needs of the youth. And there are some times that treatment is going to be prolonged for whatever reason. And absolutely we do that. But as I said, we're very keen on evidence-based practice, quality practice, adherence to practice. And this is what, the journey will be on. And research suggests that you'll be moving along and good to go at a maximum of 20 weeks within our CBT service.
Okay, so we've heard a little bit about CBT, which we often use to treat things like anxiety, low mood, obsessive compulsive disorder. We have a trauma-focused CBT that we use for symptoms that might persist after experiencing a traumatic experience. But we also have an intervention called dialectical behavior therapy, which is born out of CBT, but this treatment was developed for individuals who struggle a lot with sensitivity to their emotions and who end up doing things that are harmful to themselves or others, or engaging in risky behavior when they face really strong, uncomfortable emotions. This is our most intense form of psychotherapy. And the reason for its intensity is that we save it for the kids and the youth that are struggling most, for the families that are suffering most and are engaging in really high-risk behavior. So we kind of match the intensity of the treatment to the need of the youth. What's unique about dialectical behavior therapy is that there are multiple components to the program. So CBT that Laurel just talked about usually involves a 50-minute or a 90-minute session weekly with youth and their caregivers. When you're enrolled in our DBT program, youth and parents learn skills together in a weekly group, which is usually about 2 hours. And then youth actually participate in individual sessions where they learn how to apply those skills to their lives specifically, in ways to try to decrease those target behaviors, those really high-risk behaviors. Youth also have access, and caregivers have access to a therapist or to support outside of treatment. So we call it phone coaching. They're able to call for support, not crisis support, but for support with using skills in the real world. So if you are struggling in a moment and you're like, I really have this urge to do this thing that gets me in trouble, you call up your therapist and you're able to actually get support in real time to use the skills that you're learning to avoid that kind of behavior. So we really try to break that cycle between the experience of emotion and the dysregulated behavior. What's also unique about DBT is that the therapists that participate, that offer that therapy, they attend a special meeting. We call it a consultation team weekly, where they actually get support themselves for the therapy they provide. So it's a way of us ensuring that we provide quality care, that we provide quality DBT that's being done the way it's supposed to do, because that ensures the best outcomes. And so all of that together, all of those different pieces come together and create what we call a comprehensive DBT program. And that's what we offer at Kinark. When we think about the journey, so if we go to the next slide, Laurel, in terms of kind of your flow through service, it looks similar to the CBT journey. What I would just highlight is that it's longer. So rather than up to 20 weeks, DBT usually takes between sort of 25 and 45 weeks, we would say, or around 6 months is kind of the treatment dose that we usually expect in a DBT program. But the the assessment phase is similar. We're gathering similar kinds of information. We really want to make sure families and youth are that they understand and are committed to the approach, because we appreciate it's a big resource investment on your part to come and participate in this kind of program, and it's a big resource commitment on our part as well. And we want to make sure that we're well suited for one another before we dive into this this intensive and really effective treatment program. What's really cool about Kinark is that we actually just launched a DBT program for kids, which is fairly novel and not offered many places in Canada. So this is like the same kind of model that I just talked about. This is an intervention for young people, kids under 12, who are struggling with emotion dysregulation. They're doing things in the face of strong emotions that get them in trouble or hurt themselves or others. But this is like an adapted program for younger kids with more of an emphasis or more involvement of caregivers. And what I mean when I say that is, in a DBT program for adolescents, the teens and the parents participate in a group together to learn skills. But in our kids program, the parents actually, or the caregivers, attend the group on their own, and they learn how to apply DBT skills to their parenting. We really create these super parents who, in the face of their child's dysregulation, strong emotions, learn ways to regulate their own emotions and respond incredibly skillfully to support their child's emotions coming down and to shifts in their behavior. So we teach kids in individual sessions how to recognize emotions in their body and in their thoughts, how to control their behavior in the face of emotions. We teach them how to problem solve along with their caregivers. And we teach parents or caregivers how to understand why their child is doing what they do, understand what's kind of underlying these often off-putting behaviors, the emotions that underlie them, and how to respond skillfully, how to set limits, and how to influence that behavior that their child is exhibiting. And they also learn how to kind of collaborate with their child. How do we solve problems together versus solve problems for the child? And in DBT, we say that the goal of treatment is to build a life worth living or a family worth having when we're talking about a family-based intervention. And we have a lot of evidence to support that this intensive kind of treatment is a really good fit for those youth struggling with really severe dysregulation. Now, the two treatments we've just talked about, CBT, cognitive behavior therapy, and DBT, dialectical behavior therapy, those are kind of treatment programs that involve a lot of individual or one-on-one therapy with a therapist and a child, or a therapist and a parent. We also offer a lot of group-based interventions at Kinark. And this is treatment that is offered with therapists and then a number of youth or a number of families all together in the treatment program. And in my experience in offering group therapy, often families are concerned that group therapy is not as effective as individual therapy. But research actually suggests that simply isn't true. So we know that group therapy is an incredibly effective intervention for a variety of presenting concerns, for anxiety and low mood and OCD and a number of challenges that our youth face. And it actually offers unique opportunities that are not available in a individual therapy setting, which is often why we actually recommend group therapy over an individual treatment approach. And I'll explain what I mean. When youth or families come into a group-based intervention, they have this unique opportunity to meet others experiencing something similar to them, which is incredibly normalizing and validating when mental health sometimes comes along with stigma and shame or feeling isolated. And so while it can be sometimes hard to get youth going because they feel nervous about the idea of engaging in an intervention with others, what they actually often report at the end is a lot of soothing and comfort in like meeting others who have similar experiences. What's also really cool, what I love about group therapy, is it provides this kind of real world opportunity for kids and teens to practice skills with their peers, which is what they have to do when they're at school or in other environments. Often situations are just inherently created in a group that kind of mimic things that happen in the real world. So kids have to wait their turn. They might get interrupted. They might lose at a game, and it provides this opportunity for us to actually coach their use of skills in the real world, which is so helpful in making them or helping them feel more equipped to do these things where they need to do the most, which is at home and at school. So when we select group therapy as the intervention of choice, that's because we actually think group therapy is the best fit, not because you're kind of getting the lesser therapy offering. What you can expect in group therapy is, like I said, coming to a treatment program with other youth or families. Often there's a separate parent component, so caregivers get to meet with other caregivers and youth get to meet with other youth, usually of a similar age. And often with similar kinds of challenges. And it may not necessarily look the same in terms of the behavior. So sometimes we have kids, we might have one child struggling with anxiety, one child struggling with low mood, and one child who's aggressive in the same group. But the things underlying those challenges, comfort with emotions, avoidance of emotions, we target the same kinds of thing in the treatment. And so youth get a lot of opportunity to learn and to practice from one another. Often we have 2 facilitators to anywhere from 5 to 10 youth in a group, or up to 15 members. So sometimes when we have caregivers and youth together, we might have a bit of a larger group. Now, there's a vulnerability component to group therapy that I want to acknowledge. There's something really vulnerable about talking about challenges or things that aren't going well in front of others. And that's certainly part of it, though we don't offer a process group where all that we do is share our challenges. We kind of share a little about ourselves and what it is that we want to work on, but there's also a lot of focus on learning skills and putting them into practice. And so I never want families to think that you're going to spend 2 hours talking in front of others about all the things that are challenging in your family. There's sharing, there's vulnerability, and there's a lot of learning as a group together. And group can be really magical. The feeling after group is often that of connection and increased skillfulness, and it's pretty unique and neat to see. And of course, regular attendance and a willingness to participate is kind of essential in being successful in a group therapy. Now, another group-based intervention, but we highlight it kind of uniquely because our SNAP program is a program that requires a specific license and kind of unique training that our staff have undergone. And so we like to kind of spotlight this program separately because it's sort of a trademark program that's offered in a variety of other settings. And it was a program created locally out of the Child Development Institute, and we're really pleased and proud to offer it at Kinark. So SNAP stands for the Stop Now and Plan program, and it's a group-based program that has several components that are offered to boys and girls separately. So we have a SNAP Boys program and a SNAP Girls program, and it's considered an early intervention program for youth who are engaging in problematic behavior, often a lot of physical aggression or antisocial behavior, and it's meant to prevent them from going further down that line and engaging in criminal behavior or anything else unsavory. And the program consists of several different components. So a child group, a caregiver group, one-to-one kind of family sessions and individual support as needed, and also involves a component of school advocacy or kind of liaising with the school to help them support these youth in using their skills effectively, as well as the environment and supporting them differently so they can be successful in the school environment. The SNAP Girls program is very similar, but research tells us that there are some different best practices for treating aggression in females, with more emphasis on communication and relationship building. So that's sort of an additional component that's integrated into the SNAP Girls program that we don't see in the SNAP Boys program. But this is our kind of 4th intervention offering that you may be recommended at Kinark.
So we talked about, a little bit about importance of attendance. So you're going to get maximum benefit from your sessions when you come regularly. Now it's, clear that if you're part of a group therapy or within, SNAP, the group goes whether or not you're there or not. So, but with individual offerings, the therapist just gets stalled, right? Stalled with respect to providing treatment. And so attendance is really important and consistent attendance. So similar to that analogy of, physiotherapy, you have an injury, you go to your physiotherapy appointments and you have things to do in between the appointments to speed up your progress, or even ensure your progress. And so that's kind of the similar idea. If you stop going, your progress is going to be stalled. So it's really important to have consistent attendance. We've had situations, for whatever reason, families are not available for big chunks of time. At any one given time, and that really requires the therapist to kind of go back to the beginning. So it really hinders progress of the therapy. Humans, we drift away from what practice. We have this drift tendency. So they're going to forget the things that they have learned. They're not going to be applying them regularly. And so you just get very, very low outcomes and very little progress. So, we talk about at the beginning of our service, we really try to problem solve with our clients as to, what could possibly get in the way of consistent attendance. As we said earlier, you're not going to be here forever. If I can get you to commit to this short kind of period of time, this is the dose of treatment. If we can get through these weeks, then that's great, right? And so it's really about kind of committing to that consistent attendance that will be really important for therapy to be effective. We do have, we explain this in great detail at the beginning of our service so that it's very clear. And it might be the case that the client is saying, what, actually, this actually isn't then a good time right now because, I just picked up different shifts. I had to, I have to work more, or I can't coordinate this with others in the caregiving system. And so that's fine. You're not going to be put on that at the end of our wait list. We will put your file on hold and be there for you when the timing is better. So I want people to appreciate that. We want this to work for you. We're not here to set you up for failure. We're here to set you up for success. So if it is the case that this is not the right timing based on the commitment required, after the assessment and formulation, here's the treatment plan provided to you. Is this good? And it's like, actually, I can't. That's fine, right? Again, you're not going to be put at the back of the wait list. You're going to be put on hold with that clinician. And when the time is right, you contact that clinician and we will then get moved to get you in. Home practice is another really key factor in the efficacy of treatment. So, as we already stressed, the majority of hours are not with us, brilliant clinicians, helping you and your child. The majority of hours is outside of your time with Kinark. And so we want to make sure you have tools, but you have to actually use those tools on a consistent basis to see results. So we know that practice and skill development leads to consolidated learning. The more you do it, the faster you're going to learn this skill. The more I practice my free throw, the better I'm going to get at it. And it's also about, a lot of home practice requires, keeping track of some of the problem behaviors, keeping track of some of your, intrusive thoughts or the thoughts that are causing you problems or the emotions that are causing you problems. And actually keeping track of that, because humans don't normally do that. It's a skill that we have to be taught and we have to be very deliberate to keep track of what's going on with us. That is really helpful. And the more you do that, the better you're able to do that. And, they always say, you have to realize what the problem is before you can work on it. And that kind of having that knowledge and awareness and reflection of what's causing the problem is a really crucial first step, and it takes practice. So usually lots of our homework assignments are around keeping track of stuff that's going on with you so that we can better understand the patterns, you can better understand the patterns, and then you know what you need to do about it. We also want to make sure there's that continuity of progress. Like when you're doing more work, the more I practice my free throw, the better I'm going to get at it week after week after week, so that you get positive outcomes when the time comes. We have homework agreements. So again, this is something that we talk extensively about at the beginning of our service. We get you to appreciate what's going to be required. We get you to understand, that this is really important. It's not about dropping your kid off for 1 hour a week and then expecting them to be a different kid. That's clearly not realistic. And so that's why these types of concepts are really important for families to appreciate when you are entering into a psychotherapy relationship. So what are our key takeaways? So psychotherapy, hopefully you understand now, it is different than supportive counseling. Supportive counseling, is not going to be insistent on, you have to come here every week and you have to do all of this home practice. They're there to really help you in that moment that you need it with really practical strategies. But Kinark, we offer psychotherapy, we offer evidence-based practices, and we learned today what those were. We want to make sure that you're clear that we identify treatment targets that are unique to the individual and the family. We do a very standardized and thorough assessment, and then we identify those goals and we track those goals. So there's a lot of data that is gathered throughout this whole process. It's also important that, when we talk about goals, we're not targeting everything that could possibly be an issue in each of our child, youth, and families' lives, right? That's impossible. We really try to focus on one, maximum two at any given time so that we can be really targeted, deliberate, and then see progress in those areas. And our assessment process will identify kind of those goals that are going to give us the biggest bang for our buck, and hopefully then transfer to other areas that are also could be potentially problematic in your lives. The other key takeaways here about caregiver involvement, that is super key. Consistent attendance is key, and regular home practice is key.